So the renal unit at Beaumont was set up in 1954, originally in Jervis Street Hospital, when we bought the first dialysis machine in the country, and then shortly afterwards undertook the first renal transplants. And since then we have been the largest and main reference centre for all aspects of kidney disease in Ireland. Obviously in the intervening years there's been multiple other renal centres and university hospitals developing renal services in Cork and Galway and other places in Dublin. But Beaumont is the only centre undertaking renal transplantation and is often used as a reference centre for complex cases. Currently we have 7 consultant nephrologists, 8 transplant surgeons and the full gamut of resources necessary to treat advanced kidney disease, including renal biopsy, plasmapheresis, more than 40 dialysis stations. And as you go through the day, you'll see how all of these facilities come together.
Well, as the Centre for Kidney Transplantation, we would report probably about 70% of the biopsies performed in the country, which would include all of the paediatric biopsies and the transplant biopsies, and as I say, about 70% of adult biopsies. Kidney biopsies are a little unusual in comparison to other types of biopsies because it requires several types of examination, which includes the usual typical histology, but as well as that, they require direct immunofluorescence to see if there are any aggregates of immune complexes in the kidney. And then most significantly, it includes the need to do electron microscopy, which is where we would look at approximately 20 to 30,000 times magnification in comparison with, say, 400 times magnification we would do with the light microscope. Every 2 weeks, we would routinely do a kidney biopsy conference, in which every biopsy that's performed will be discussed. And at the meeting, it will include one or both of the pathologists, but most significantly, a lot of consultant nephrologists, and it includes nephrologists with a variety of subspecialist interests, including transplant, rare kidney diseases, and also paediatric nephrologists, where we discuss the case, the diagnosis, how severe the disease is, and then what the management implications and plan of action is.
So thankfully we're able to offer, I think, a very professional kidney biopsy service here. Myself and Dr. Mark Denton, one of the other nephrologists, do all the ultrasound guided bedside biopsies. A lot of them are done as day cases in the day ward. The patients have bloods done the day before, have the biopsy done early in the morning, and then go home that evening. Of course, there are some patients where we do inpatient biopsies also. I think it's fair to say that we have a fantastic renal pathology service here. In emergency situations, we can do the biopsy before 11 and have a result by 4 or 5 p.m. that day. We can also get pathology reads on the weekend where it's clinically urgent. But for the standard biopsy, we get results within 24 hours. Again, regarding plasmapheresis, I think we're very lucky here in that we use a hemodialysis or CVVH system to provide the plasmapheresis plasma exchange. And we've got a fantastic group of nurses here who are trained in plasmapheresis. And this has been corroborated by hematology. I think that we're one of the few centres, if not the only centre in Ireland, that is able to provide plasmapheresis literally within hours of the patient being admitted to the hospital or coming through the emergency department. In almost all cases, particularly say for the emergencies like TTP, but also some of the glomerulopathies or whatever, we will be able to provide pheresis within 12-24 hours of diagnosis or admission. And we provide 2 types. We can do the standard filter, where we replace with albumin and clotting factors or whatever, or we use the so-called cascade or double filter, where we're worried about bleeding problems, etc.
Beaumont Hospital provides the National Kidney Transplant Service for the Republic of Ireland, and over the past few years we've performed an average of 160 kidney transplants annually, about a quarter of which are living donor transplantation. Our transplant outcomes compare very favourably internationally, and in the more recent era our 10-year allograft survival is 74%. For our nephrology trainees, they have opportunities to attend the Living Donor Evaluation Clinic, as well as the Living Donor Multidisciplinary Team Listing Conference attended by our colleagues in transplant surgery, radiology and the HLA lab. Having the genetics clinic on site has been very beneficial for our living donor evaluation, especially for those living donors who are interested in donating to perhaps a relative with a hereditary kidney disease. We also have a transplant evaluation multidisciplinary team assessment clinic that our trainees will attend, and this involves evaluation again by transplant surgery and nephrology, as well as other assessments including frailty assessments. So overall, when our trainees come to Beaumont Hospital, that is where they will receive their very specific transplant training during their higher specialist training in Ireland. Sure. In addition to transplant, we also provide and manage plasma exchange here at Beaumont Hospital. So we do see a very unique cohort of very complex patients that often will transfer from other centres for this specialist management.
So this is our renal day ward where we do a lot of our activity, all our renal biopsies, our urgent patient assessments, our line insertions, line removals, angiograms. This facility is open 5 days a week from 8 in the morning until 8 in the evening, and it really has transformed our practice to allow most of the care to be delivered as outpatient. And it's particularly useful for all manner of acute and chronic illnesses.
We're able to biopsy our patients on the renal day ward 5 days a week. It's a relatively simple procedure. They're admitted and get the biopsy done early in the morning and they're away by the late afternoon. It's a relatively simple procedure. And patients will always feel that it's going to be more than it is, but generally they feel afterwards that there was nothing to worry about, and the complication rate is very low. So it's something that we can do here in Beaumont very easily, and it's done by nephrology. At Beaumont Hospital, it's the main hospital in Ireland where nephrologists will put in Tenchkov catheters. That's the peritoneal dialysis catheter. The advantage for nephrology to put them in is that we can put them in essentially straight away. So when we feel the patient needs a PD catheter, it can be organised very quickly. Whereas other ways of getting them in through surgery, it can take longer to organise. There are lots of other advantages though for a nephrologist to put them in. One is that we do it under local anaesthetic, so the patient gets the procedure as a day case, so they don't have to stay overnight in hospital. And also the literature shows, and it's been confirmed by the PD catheters we place, that this technique, which is known as the Seldinger technique, is actually associated with very good outcome in terms of the function of the catheters, and in terms of complication rate. So we're very pleased with how the service has developed.
So here in the renal day ward, we provide many key services for renal patients on an outpatient basis, such as renal biopsies, Tenchkov insertions and removals, permacath insertions and removals, vascular access clinic, and the transplant clinic, to name but a few. All the services here that we provide within the renal day ward is very efficient and beneficial for the patient, as it reduces patient and hospital burden.
Welcome to our dialysis unit. This unit was opened a couple of years ago. We have 36 outpatient stations. Unit operates most of the daylight hours. But you can see we have each of the bays laid out in bays of 4 patients. And we have a number of isolation stations also. Well, we dialyse in excess of 350 patients on dialysis spread. This is the main unit and other units around the city also. Each of the patients have their own television with internet access and video on education, different aspects of kidney disease.
The nephrology services comprise of an acute dialysis unit here on Peter's ward, an inpatient service for a patient requiring hospitalisation within Beaumont Hospital. I also oversee plasmapheresis within the hospital, including cascade filtration. Beaumont is a centre of excellence for nephrology care in Ireland, incorporating transplant service. Currently there are 160 patients receiving outpatient dialysis service. There are 10 patients requiring inpatient dialysis services on a daily basis, We also have 75 patients attending our satellite service up in Drogheda and 52 patients attending our satellite service here in North County Dublin.
Beaumont is the main hospital in Ireland for facilitating home haemodialysis. We have 28 patients currently on home haemodialysis. The advantages of home haemodialysis is definitely that you can do more dialysis rather than the 3 times a week. And this is what gives the excellent outcome for patients on home haemodialysis with very good control of the blood tests.
The home therapy service in Beaumont Hospital comprises peritoneal dialysis and home haemodialysis. We have around 90 patients nationally. We have clinical nurse specialists in post, and we train and educate our patients to self-manage at home in their own environment. Home therapies follows the national framework of Sláinte Care, which allows patients to use community-based services and stay in the comfort of their own home.
The patients are monitored via a bespoke portal on a daily basis, Monday to Friday. This allows us to observe their daily readings and pick up problems at a much earlier stage than we would have traditionally. The big advantage of the patient in reducing the frequency of these in-house visits is it greatly reduces patient and family burden.
Due to the success of the current programme, we're expanding our programme and hope to see at least 20% increase in patient numbers by next year.
Kids who are at their 16th birthday enter a transition program, a formal transition program between us and Temple Street, whereby I will go across to Temple Street and do a joint clinic with the paediatric nephrologist and see both parents and patients there. And then we transfer their care across here into a specialised transition clinic that I run with the support of my psychology and psychiatry colleagues to help care for the patient in a holistic manner, both from the point of view of their kidney transplant and their continued personal development, either their schooling or any mental health issues they have due to the illness occurring during their childhood. On average, we take about six to 8 across in a year from Temple Street to here. So all kids in Ireland, bar those in Cork who have a kidney transplant, come through Beaumont through the transition programme, and then depending on whether they're going to university in Dublin or outside of Dublin, we'll then decide where their care moves to at that point.
We are working on mainly in autosomal dominant polycystic kidneys, which is the commonest genetic conditions that affecting adults, leading to end-stage kidney disease. In particular, we are interested to define why someone in the family will have end-stage kidney disease at a certain age, while his relative will have it later or earlier. And we believe genetics play a role in this. However, other factors as we are highlighting will have a great impact for the nephrology community.
So the medical school attached to Beaumont Hospital is the Royal College of Surgeons in Ireland. And through this hospital, we bring approximately 300 medical students in final med every year. The students all spend a certain amount of time in Beaumont and the rest of the time in other obstetric, maternity and some other general hospitals around the country. In addition to running a medical school, the Royal College of Surgeons obviously runs an extensive research operation based partly here in the hospital and partly in town in the main building. The hospital also runs training programs in every discipline you can think of. We run an intern training program. We run a senior house officer or basic medical training program in conjunction with the Royal College of Physicians in Ireland. And then we run specialist registrar training programs, 5 or 6 year programs in pretty well every specialty that you can think of. And in our case, in nephrology. We have in this hospital 8 registrars in nephrology, most of whom are on specialist registrar training schemes. We also run training programs in this hospital for pathology, radiology, physiotherapy, laboratory sciences, and all the disciplines. The hospital is well equipped with 2 big lecture theatres, one of which you see here today, and then there's a multitude of tutorial rooms scattered across the hospital and in the medical school building across the way.
So Beaumont Hospital is one of the major academic teaching hospitals in the Republic of Ireland.
It has approximately 3,000 staff and 820 beds. It provides emergency and acute care services. It has 54 specialties, and one of these specialties is nephrology.
Hey.
So it is the principal teaching hospital for the RCSI, so the Royal College of Surgeons Ireland and DCU, Dublin City University, and other academic institutions, in respect of training and in respect of research, making it the ideal location for the reference centre for rare kidney disease. So the nephrology department includes the following services. So we have Peter's ward, which is the general nephrology ward. We have the dialysis therapy centre, which is a state-of-the-art dialysis service. We have the acute dialysis service, which is a 24-hour service 7 days a week. We have plasmapheresis, and we also have a home therapies centre, which has peritoneal dialysis and home haemodialysis. And again, a state-of-the-art renal day ward. The nephrology department is fortunate in that it has a number of clinical nurse managers and clinical nurse specialists which support these services. We have 200 nurses and healthcare assistants working within the department.